Hello, this is Paul Barr for Hospitals and Health Networks. Today I'm speaking with Quinn McKenna, Chief Operating Officer at the University of Utah Hospitals and Clinics in Salt Lake City. Quinn is here to describe how boosting transparency in a significant way can help a hospital or health system improve and change. Thanks for being here.
Thank you. It's my pleasure.
Why is the university embracing transparency in the way it is?
At the University of Utah, we've been on this journey of trying to change the culture of the University of Utah for about the last 8-9 years. And as we've gone through this journey, we've learned that the more transparent we are, both in our vision and our goals, but then also in giving feedback to the physicians in the organization, that it actually helps move them faster the more transparent we are.
Can you give some noteworthy examples of how you've done this?
Well, as we started the journey, let's just take around the exceptional patient experience. We've really tried as an academic medical center to keep the patient as the focus. And when we started this journey, it was really the hospital talking. We were talking to ourselves. We were sharing information with ourselves. And after about 3 years of doing this, we realized we were still right where we had started. We hadn't made a lot of progress. And so about 8 years ago, our senior vice president gave a charge and said, this is not a hospital issue, this is a hospital and a physician issue. And so really tried to engage the medical staff at that time. And so instead of just being transparent amongst ourselves, we started to share information with the physicians. And that helped us a bit, and we moved more, and then we started to share information more broadly, not just to individual physicians, but to their division, to their academic chairs, and that got them engaged. And then what we've done most recently over the last 2.5 years, and that's what I'm talking about tomorrow, is we've taken our patients' comments and we've put them online. And so we've become radically transparent so that everything that our patients are saying about us and about our physicians, you can see online. And it really has changed the focus of the organization. And so we're very proud. We started about, when I arrived about 7.5 years ago, we were the 25th percentile patient satisfaction. You know, not something to write home about. We've achieved the 87th percentile patient satisfaction overall this year. And actually some of our units have been performing at the 99th percentile. And so very proud of what we've done.
What have you learned along the way in this process?
Well, some of the learning is there is no silver bullet. You have to be tenacious and you have to just keep working at this. And so even though we feel that this last piece in the last 2.5 years of putting the patient comments online has really helped to move us, it's been setting this foundation of working at it over years that has helped us. I think another lesson that we've learned is when we initially shared the information, like with the physician, said, okay, here's what the patients are saying about you. We blinded the information. And so the physician would see where they were as compared to their peers, but then they didn't know who their peers were per se. And when we unblinded it and said, no, that's you, and here are your peers by name, that really got the attention of the physicians. And so I think that was a very important lesson. I think another lesson that we learned is when, instead of just sharing it with the physicians, we shared it with their leadership, so the chairs of surgery and medicine. And in fact, we'd been on this journey for 4 or 5 years, and once we shared this unblinded information to the chairs of the departments, they started to get engaged. In fact, one of them came to our leader over our exceptional patient experience after we'd been doing this for 5 years and said, oh, I just saw this information. Now, what is this we're talking about? And so that was a very important lesson. I think a couple other lessons that we've learned is that the patient wants to be part of the process. And so even just like coming here to San Francisco, my wife is with me and we're going to go out to eat. And what did I do? I got online and said, best restaurants in San Francisco. And so all of a sudden I see the reviews, 4 stars, 5 stars. I read the comments. And one of the things we've learned is patients want to know and they want to be involved. And healthcare is so much more important than a dinner out or buying a blender. And we recognize that there's people are telling our story.
From what I understand, it's raised your profile online as well.
It has raised our profile online. Where this all started is we were being transparent internal to our organization. And let me just share a story with you. One of our colorectal surgeons came to us one day and said, I got a call from my sister-in-law, and she says, there are people talking about you online, and it doesn't look good. And there were other organizations ranking physicians, and her rank was 1.5 stars out of 5. But yet we know she's a fantastic surgeon, and so she was a little concerned. And that was 1.5 stars out of 5 with 3 respondents. But we knew we had hundreds of comments for her, and that was actually the catalyst for us to say, you know what, we've got a good story, we're going to put it online. She's actually, out of 5 stars, ranked 4.7 with more than 120 individual patient comments.
It's a huge difference.
And so when you go on Google, instead of finding that one that has 3 comments with a 1.5 rating, ours pops up first with valid information, valid comments, and when you get online as an individual, if you're going to a restaurant, if you pulled up something that just had 3 comments versus 200, which one are you going to trust?
Right, the bigger one.
And so this was a lot of power for us, and it's a great story, I believe.
Well, thank you for sharing it.
Thank you.
This has been Paul Barr for Hospitals and Health Networks magazine. Thanks for watching.